There are many reasons why people develop congestive heart failure. Their heart may have been damaged, or they may have other medical problems which have led to their present condition. We spoke with Dr. Henry Belacy of Desert Regional Medical Center in Palm Springs to learn more about the diagnosis and treatment of congestive heart failure.
Congestive heart failure is a problem that develops when there has been damage to the heart muscle. It can be damaged by very common problems: high blood pressure that is not treated properly, or heart attacks where people have damage to their heart muscle, or if they have valve disease or some kind of muscle disease that are rare. So the first symptom that heralds the onset of congestive heart failure is increasing shortness of breath on exertion. The next thing someone may notice is that they'll wake up at night and they feel sort of a suffocating feeling. They really are thinking they might have a nightmare. They get up, they go to the bathroom, urinate, and find that they're urinating more at night than they were before. And they find it takes a few minutes, maybe 5 or more minutes, before they feel comfortable to lie down because the congestion is flooding their lungs. They may also notice that their feet are swelling. We cannot talk about treatment in congestive heart failure if we don't talk about prevention. Absolutely, heart failure is preventable. Let's look at the primary causes of congestive heart failure in the American population. The primary cause of congestive heart failure in the American population is coronary artery disease, which probably affects as much as 10 or 12 million Americans. Hypertension affects about 50 million Americans, and many patients have both hypertension and coronary disease, so there's an overlap there. We now know that much of coronary artery disease is preventable. Hypertension, if not preventable, is treatable to the point that you can prevent congestive heart failure by tight control. We were taught that a normal blood pressure is 120/80 in medical school. We now recognize that the American Heart Association, American College of Cardiology now tell us it's 115/75. That when your pressure is consistently higher than that, over time you will have a somewhat slight but definite increase in risk of a premature death or complications. The complications of poorly treated risk factors, particularly hypertension, include the development of congestive heart failure, the development of kidney failure, which will lead to congestive heart failure as well, and heart attacks. So this is preventable. If we control the standard risk factors, if we keep our blood pressures well controlled, particularly below 130/80 for most of us, if we keep our cholesterol well controlled, and we have a good risk ratio, where we have a nice HDL, which is a good cholesterol, and a total cholesterol less than 200, and an HDL around 50, so our risk ratio is less than 4. If we do not smoke cigarettes, and if we tightly control diabetes if we have it, then we don't damage the blood vessels. This does not therefore then lead to blockage in the arteries that cause heart attacks. We therefore don't damage the heart muscle, and we therefore don't end up with congestive heart failure. Or if we control the blood pressure tightly, the heart does not become enlarged nor thickened. Once the patient has established early signs or symptoms of congestive heart failure, the first drug we use is a diuretic, simply to get rid of the excess fluid. Once the fluid's off, the very first drug we use is the drug that has been proven to prolong life, or called ACE inhibitors. Once the patient's on an ACE inhibitor, because the ACE inhibitor dilates peripheral blood vessels, it sort of unloads the heart, like putting the heart in overdrive, if you will. So as a consequence, the person can then generally be taken off of the water pill or the water pill reduced. Then, if the echocardiogram shows the ejection fraction is less than 50, particularly less than 35, and if the patient is a candidate for it, the next drug that has been shown to work hand in glove with the ACE inhibitor is a beta blocker. And there are several good beta blockers on the market in the treatment of congestive heart failure.